Hi guys, Dr. Luster here, and I want to talk to you for a second about upper cervical technique. So upper cervical technique is a very specialized technique that really focuses on just your upper cervicals. It really focuses on the base of your skull, C1 and C2. So C1 is also known as your atlas, and C2 is known as your axis. Now, this three combination is pretty important because if you think about it, it's where your brain connects to your spine. So all information travels through that very, very small area. So if there's any problems there, it can have massive effects across your whole system. So if there's any place in your system that you needed to, if you can only adjust one place and you needed to do it super well, upper cervical is the place. It really is. Now there are some other fantastic techniques that work on your system from the bottom end of it or whatever, but truly, if you're going to really affect the immune system, or I'm sorry, the nervous system or any system, and really want to have far-ranging effects, that is the place to have it. Because again, it's where everything goes to and from through the base of your skull. So upper cervical technique is significant. It is kind of an intense adjustment. It is one adjustment to that area, and it's you find the directionality of that by taking x-rays and by doing some thermal scans, which help figure out what exactly, what angle, what degree, and it's very, very cool to be able to isolate that to a very specific degree. And this is your upper cervical listing, and you come in and you tell them that, or they have it in their file, and it changes how the doctor stands, where they stand, the angle that they're holding their hand, all of those things to give you the appropriate, specified, unique adjustment to you. And like I said, it's based off of your images and whatnot. Now, here at ISC, we do not end up taking x-rays for a number of reasons, but mostly because we're so close to like Stone Oak and and also most of my patients end up coming in with that are complicated enough for needing those things. They end up coming in with their own. So we don't end up taking them here, but we are competent in upper cervical adjusting in case that is needed for whatever reason, because sometimes it is. So I usually like to do more gentle techniques for the upper cervicals if it is called for, but every now and then you need to do an upper cervical toggle, and that is what that adjustment is called. It has truly profound effects, and it takes a fair amount of classes and experience and whatnot to get certified in it, because it's kind of intense. It's kind of a lot. If we ever had to do an upper cervical adjustment, I would definitely walk you through it, because it can be a little bit intense, but it is fantastic. They are really, truly impressive adjustments. So I hope that clarifies a couple of things. I probably won't end up using it on you because, like I said, I usually need to use that more as a last resort, just because I would prefer to do it other ways. But it is a fantastic adjustment, and you might see it every now and then. And I definitely am always just looking for better ways to adjust that one bone, or those three bones specifically, I guess. But those upper cervical bones, the best ways, because they are that important. Anyways, I hope that helps a little bit, guys, and if you have any questions, feel free to reach out. Thanks.